Just want to say welcome as folks are starting to get connected and log in. We'll get going in a couple of minutes. I'm going to give just another minute or two for people to connect. And as you're logging in, I don't know if we've launched it yet. If we have not, we will be launching just a quick poll. Take a minute. There are 3 questions in there. We'd love to hear from you. How large is your portfolio? What's your role in your organization? And if you are already using a resident outcomes data system, we'd love to know which one. Then we'll get started in just a few minutes. All right, well, we are just about a minute and a half past. I think we'll go ahead and get started. I'll leave the poll up for just another moment. If a few other people log in, then we can close it in another 30 or 40 seconds there, whenever you think is appropriate. So I just want to start off by saying welcome and good afternoon. Welcome to today's webinar, Using Data to Support Resident Outcomes. This is the second part of a 2-part webinar series that's focusing on outcomes measurement, looking at how data is valuable both internally and externally for resident services practitioners. Thank you again for joining us today. I'm Alexandra Nassau-Brownstone. I'm Director of Resident Outcomes and CORES at Stewards of Affordable Housing for the Future, otherwise known as SAFE. And I'm also joined by my colleague, Nicole Manchester, who serves as Data and Analytics Manager at SAFE. Nicole and I are so pleased to have representatives from 3 different practitioner organizations: Mercy Housing, Operation Pathways, an affiliate of the NHP Foundation, and Volunteers of America joining us today. And they're here to share their experiences using different online data systems that each of their organizations uses to track resident outcomes. Before we get started with the presentation, I'll take just a minute on a few housekeeping items. We anticipate quite a few of you on today's call, so we do have everybody's lines muted. If you have a question, please feel free to use the chat or the questions boxes. As we see questions that come through, we'll do our best to address the questions as they arise and to direct them to the different presenters as they're presenting or following their presentation. But we will likely also hold a number of them to the very end and hope to have an opportunity for each presenter to reflect and to engage on a number of those questions. The webinar is being recorded, and we will plan to make it available on the CORES resource library. All right, why don't we go ahead and take a look at the poll results, get a sense of who all is joining us today. So we've got a range of different size organizations, a lot of directors or managers of resident services, but representatives across the board, more on the frontline side of resident services, asset management, data and analytics, and a few of you that identify as other. If you don't mind, feel free to add that in the chat so we know where you sit in your organization. And a majority are not currently using a system, and then a few using AASCOnline, Family Metrics, ETO, and Salesforce. Terrific, thank you. That's going to be helpful for us. Okay. So as I mentioned briefly, this is the second part of a 2-part series. The first webinar, which was broadcast in September, provided an overview on outcomes measurement, provided some considerations on how data can be valuable both internally and externally for resident services practitioners, explored some of the ethical questions raised by collecting and using data, and give a very high-level overview of many of the commonly used data collection systems. As I mentioned, the recording and the slides for that webinar can be found in the CORES resource library, and we will also send them out after today's webinar. But today's session is an opportunity for you all to learn a bit more about 3 specific data systems: ETO, which was developed by Social Solutions, AASCOnline, and Family Metrics, both developed by the Pangea Foundation. CORES is not endorsing any of these systems, but we wanted to bring together practitioners who use these systems so that they can share their experience and showcase a little bit of how these systems have been useful for them. It's an opportunity for all of you on today's call to ask questions of your peers and to better understand what they like about the system and what some of the limitations they've experienced are. We hope that this is an opportunity to explore the systems and get some additional information and some considerations that might be useful for your own organizations as you're evaluating various online data systems. For those of you who are joining us for a webinar for the first time, just a few things about CORES. CORES, which stands for Certified Organization for Resident Engagement and Services, launched in 2018 as a certification that recognizes both owners and third-party providers that have developed a robust commitment, capacity, and competency in providing resident services coordinations in affordable housing. In addition to developing the actual certification, CORES also seeks to support the field and practitioners through peer exchange, looking to high-capacity practitioners to share their experience, their best practices, and resources in an effort to support more organizations in building those robust systems of service coordination and greater capacity across the field. We do this through our resource library, and we also launched a COVID-19 resource page earlier this year, our newsletter, and these quarterly webinars. CORES is operated by SAFE, which is a collaborative of 13 of the largest high-capacity nonprofit affordable housing developers across the country. Our members own and operate over 147,000 rental homes and serve over 259,000 people. In addition to being committed to preserving and expanding affordable housing, SAFE members are also deeply committed to service-enriched housing or resident services. And you will get the opportunity to hear from 3 of them and talk with 3 of them today. About 5 years ago, SAFE formed a community of practice to support a system of enhanced resident services coordination, which brought together SAFE members and other practitioners across the affordable housing and resident services fields to focus on laying out fundamental key decisions, functions, and capacities that are needed to support a robust system of resident services coordination. This framework, for a system of resident services coordination, was born out of that work, and it's also the foundation for the CORES certification. It's essentially a decision-making framework that articulates an approach to how resident services often functions in an organization, integrating resident services into the development process, the management of the property, and with asset management. We're going to drop a link in the chat. If anyone has not taken a look at this, it's also in the library. This framework comes with a companion set of guidelines. The steps articulated in this framework demonstrate how organizations are thinking about data collection, its practical use in informing resident engagement and programming, and how organizations use data to understand their own success and impact and to inform the evolution of their work over time. And for CORES and for SAFE, more broadly, as we engage more and more with organizations operating across the country, we get lots of questions about outcomes and data tracking. And so this webinar series was developed in part as a response to many of those questions and requests for more information about outcomes and data systems. So at this point, I'm going to pass it over to my colleague, Nicole, who's going to provide a very quick introduction to the cycle of data and the world of data systems that are commonly used in the resident services field.
Hi, everyone. Welcome. My name is Nicole Manchester. I'm the Data and Analytics Manager for SAFE. Apologies, my voice is a little scratchy today. So, like we think of CORES as a cycle of evaluation. We also think of data and data collection and planning and data reporting as a cycle, moving from data planning to collection to data quality and quality assurance, reporting, and then storytelling with the data. So we can move on to the next slide. And so, as organizations are moving along the cycle of data collection and are collecting more data and thinking about processes for evaluating that data and reporting, they might get to a point where they have to start thinking about data systems and a database of some kind of data platform. And so we developed a memo looking at the field of CORES applicants and SAFE members, and looking at the data systems that seem to be the most popular, most commonly used across the field, and came up with a list of those systems and tried to provide some details about what we had heard were some of the benefits and some of the challenges or drawbacks about each of those systems, and kind of, which organizations they might be a best fit for, some cost, the details. And so we developed this memo that I think Sarah is going to provide the link to in the chat in a second. But this slide is kind of a synopsis, thanks Sarah, synopsis of some of the systems that we found to be the most popular, most commonly used across the field for those organizations that have gotten to a point where they need a data system of some kind. And so for today's webinar, we picked a few of these systems that we tapped some of the SAFE members to talk about their systems that they use and how they've used those systems. And it was actually just kind of a random occurrence that happened to be the first 3 systems on our list that we have presentations on today, but we're going to be talking about ETO, AASCOnline, and Family Metrics. And thanks. And we have some great staff at each organization to talk about each of these systems. So we have Chris from Mercy Housing, who is going to be talking about how their organization uses ETO. We have Donna and Natasha from Volunteers of America, who are going to be talking about using AASCOnline. And then we have Natalia from Operation Pathways, who's going to be talking about how they use Family Metrics. And so we're just so excited to have these great presenters talking about their systems. So I think without further ado, were there any other details to talk about, or should we go ahead and hand it off to Chris to talk about ETO? So I'll let Chris introduce himself.
Thank you, Nicole. I'm going to go ahead and turn off my video just so there's no risk of lagging, if that's okay with everybody. Can you see my screen? Okay, perfect.
Yep, success.
Okay, so Mercy Housing, who are we? So Mercy Housing is one of the largest providers of nonprofit low-income and affordable housing in the United States. We currently operate in over 39 different states. We have, this is a screenshot right here that shows, approximately 342 properties, and we're constantly growing, even during things that have taken place during COVID. The need, if anything, the need for low-income and affordable housing has grown. So, and with that, so has our mission. We have 3 demographics that we look at, or 3 different property types. We have senior properties, family properties, and then supportive properties. So a lot of organizations and a lot of softwares that we discuss might be focused on senior or family. Well, the unique thing about Mercy and the particular software that we currently use is that it allows us to focus on all 3 things, and it has that flexibility. Just a little bit more about us. So specifically, our software supports our resident services programs. At 252 of our properties, currently we have services that we offer to our programs. Most of them are direct services. In a couple of instances, we have third parties that come in and provide those services, but the majority of our organization is direct. So that means we staff the resident services team members and provide the services directly. One interesting fact, just last year, 2019, we served over 1.5 million pounds of food, and our annual household income was just under $17,000 per resident. So talking about data use and collection, we focus on 5 primary areas that we serve our residents: health and wellness, community participation, out of school time, that's focused on our family properties, housing stability, and financial stability. So within each one of these categories, we have specific goals that we aim to achieve, and we also have specific metrics that we look to track. As I kind of mentioned just a moment ago, most of our data collection source is through direct resident interaction. So our resident services coordinators and our case managers at our supportive properties They're interacting with our residents directly, and that's how we capture probably 95% of our data. The one exception to that is our annual resident survey. So this survey is one that goes out to over 10,000 of our residents every single year, and it captures specific information relating to their health and wellness, their, whether they, indicators of social isolationism, and also, whether they have primary healthcare providers and sources of income. I would say that the biggest challenge that we face, and that probably any other organization that manages or seeks to manage data faces, is measuring outcomes over time. So not just saying, hey, we served X number of residents, but how did we impact their lives? How do we make data paint a picture of what we've done to improve the lives of our residents? This right here is just one example from our most recent impact report for 2019. So in this example, we track those 5 different areas just on a very high scale, but to give you just an idea of some more specific metrics that we may track. So activities over time within those 5 categories I mentioned. And so the software that we use, ETO, allows us to get reporting that does this level, so we can break it out into quarterly, we can, build all kinds of, charts, but we also want to be able to provide reporting to our end users, our resident services coordinators, so they can specifically see line by line breakdowns of the resident served. When was my last contact with that resident? And these are ways that we enable not only our end users, our resident services coordinators, to be able to evaluate their own progress, but to keep up with what they're doing, identify any shortcomings or any areas of follow-up, and it allows our supervisors or program managers to evaluate our staff as well. So we're able to do all of those different things with our software and our reporting. So going a little bit more into ETO. So ETO it stands for Efforts to Outcomes. It is by an organization called Social Solutions. I pulled this information directly from their website just because it is a very good overview of the different things that ETO offers. So everything from case management, outcomes measurement. It does allow integration. Our current integration is an example. If you have a data warehouse, or if you have all Excel sheets right now, you've never had a software before. There's a lot of capabilities within this particular software to batch upload data. If you can get it formatted correctly, you can upload, hundreds or even thousands of records at a time from, your current data tracking. It is very, very flexible. So I was looking at the slide that, the team was sharing earlier, and kind of how Salesforce, as an example, is like a blank slate. And I would almost say that ETO is like a blank slate, but it also comes with certain things out of the box that you could take advantage of. So if you're a senior property, there are a lot of senior-based forms that will come automatically with it. It's definitely not as robust as AASCOnline in that regard. And then other examples are supportive. So things like the Arizona self-sufficiency matrix and stuff like that, those types of forms come pre-built with ETO for your organization to take advantage of. But I will say that by and large, the biggest pro of ETO is that it allows you to build pretty much any type of form and any type of reporting you could possibly need. It offers workflow approvals and alerts if that's something you wanted to take advantage of, and it's very highly configurable and scalable. For our specific experience, we've been using this particular software since 2011, and we've grown with it, and it has changed a lot during that period of time to offer various different things. I mentioned earlier that we use it for staff self-service reporting and also evaluation. Now, the back end of ETO, it's important to understand, is SAP Business Objects. That's the reporting tool. And it is a tool that can be somewhat cumbersome and complex to use if you don't have, the staff devoted to reporting. So I will say, from a benefits and challenges standpoint, using the reporting tools that are available to ETO, it can very, very much achieve anything that you're looking to achieve, but it can be challenging, from a reporting standpoint. Currently, in full transparency, I will say that Mercy Housing, since we've been using the software for the past 9 years, we are actually going through an RFP process to look for a new software. So anyone that's coming to this webinar that's kind of like, hey, it's understandable that an organization is going to grow over time. And so we've just gotten to the point to where we're so large and we have to track so many things that ETOs might not be the best software for us anymore. But I will say that if you're a medium-sized organization or a smaller organization, the tools offered by Social Solutions like ETO or their other product, Apricot, they're going to be really good options for you. And I will say specifically, if you're an organization that's not going to grow a lot or grow rapidly over time, then these softwares are really particularly going to be the types of softwares you're going to want to be looking at. They're also good softwares for first-time organizations. So if you're going from Excel spreadsheets to your first time looking at a data management tracking software, that these will be good for you. And the flip side of that is if you're a very large organization, if you're growing rapidly, if you have a lot of different types of services, that you're serving, then you might want to look at a different software. So it is kind of like a two-sided coin in that regard. Final considerations. I just wanted to mention that we've all been where you are before. We've all been an organization that has had, little or no data tracking experience before. So I just wanted to mention that, Mercy Housing is here to offer our advice, our experiences, and help in any way that we can. So please don't hesitate to reach out to me if I can help in any way. And I'll kick it back to y'all.
Great. We did have one question that I thought it would be helpful to just have you answer, Chris, and then for the future presenters, if you can comment on this too. Kristen is asking, do each of the organizations represented have a designated position to oversee their database and outcomes tracking? And we don't currently have a work, so we didn't ask folks to bring this, but I think they're interested in sort of how the data gets entered and how it gets, who's sort of responsible for what elements of entering the data and managing the data and doing the reporting.
Yeah, so
and maybe that's a complex answer, but
Mercy Housing is a little unique in that, so I work for IT, and our resident services program basically is like my primary customer. So I don't fall directly under resident services, but I manage the system. So because of my role managing the system, I have to have a basic understanding of all of those areas. But I will say it can be done either way, for sure. I've seen it done different ways for different organizations.
So you want me to answer my part, or you want to wait till I get to my piece? You want me to answer?
Donna, perfect segue. No, perfect segue.
No, I was going to answer. No, I was going to answer the question broadly. I mean, Volunteers of America, of course, the service coordinators put the information in the system, and I actually do a lot of report running, so we see what's happening nationally. And the service coordinator and their regional directors can actually run reports, but normally I'm running the reports and maybe sending it over to them, and maybe there's some issues and we have discussions about it. And Natasha runs reports for quality assurance. So we pretty much are not technology people. I mean, I don't know IT. I'm doing well being on this call, the Zoom. So it's been a simple process. So I'm able to do it.
And AASCOnline, they also help us with, running the reports and everything. So we have conference calls, we have meetings with them, we tell them what we need, they show us how to do it, or they run it themselves.
If I could just add in there, I think it depends a lot on whether the organization, depending on what kind of database you have, if you want to rely on, the tech help that the company that's running that database provides, and you might have to pay a little extra to get that kind of support, or if you want to bring it more in-house and have an in-house person like Mercy that kind of maintains the database and creates reports and creates forms and can do some of that customization and upkeep work. So I think you could have two different approaches to it, and it also kind of depends on the database and what support that company, like Pangea Foundation owns AASCOnline and Family Metrics, and it seems to provide a pretty good level of support. The other companies that, it might be a little more challenging to get that same kind of level of support. So And
And AASCOnline is pretty inexpensive too. So when we ask them to run a report or develop a system, data that we want, questions that we want to ask, it really doesn't, you know, there's nothing we've done that's over $3,000. It's usually very small amount of money for us to make a change, to add more questions on a survey, or it's just, they make it easy.
Well, why don't we turn it over to Donna and Natasha to do just a sort of brief overview on Volunteers of America and on AASCOnline. I think that would make sense, and then we can see small. Oh, here we go. Success. Great.
So I'm Donna, and Natasha is over there. But I'll just give you a little brief overview. Volunteers of America National Services has about 20,000 units of housing that house seniors, families, and special needs populations. We're in about 42 states, including Puerto Rico. We also serve in the service coordinator program probably over 8,000 residents. So I'm here to talk about AASCOnline. It's we're not going to have it as fancy as Christopher. He showed off this time. He did a great job. But we're going to tell you a little bit about AASCOnline. So AASCOnline has been around for about 16 years, and that's when Volunteers of America National Services joined. It was developed for and by organizations with the HUD-funded service coordinator program. And I would say the AASCOnline's big breakthrough for us was when the service coordinators were able to print a complete semi-annual report and use the data that's in the system. That was major because we had been doing it, typing in the HUD forms, which was pretty complicated. So that was the breakthrough for us, I think, with the program. So we used AASCOnline for 10 years, and then our leadership wanted to make a change to another system so that we could get, so we could report outcomes. So after 4 years of using that system, we discovered that AASCOnline was a better system. And as a side note, when I announced that to the service coordinators that Volunteers of America was switching back to AASCOnline, I actually got standing ovation. Currently we have 135 service coordinators using AASCOnline.
Yeah, we switched from Service Point. They were in Service Point, and it was just not as user-friendly. It wasn't specific to service coordination. We just had a lot of issues getting reports and data. We had a designated consultant that was just handling everything that we had as a consultant. So it was just not working out well. But like Donna said, when the service coordinators were there previously and they knew all about AASCOnline and were previously using it and weren't too happy we left in the first place, we're overjoyed.
I would say I work very closely with the staff at AASCOnline. They, so it's not that I'm like pushing AASCOnline for everyone, but for us, because I've had 2 different databases to deal with, and I want to have some autonomy when I'm running reports and looking at information to see what's happening in our residents' world. AASC has been extremely helpful. So overall, with our rating, AASCOnline, I'd give them a 9 out of 10. I think the benefits outweighs its limitations. So I'm going to give you a set of you know, a few benefits that I like. So I think the first thing, it's intuitive and it's simple to use. When you have service coordinators, they're social workers. And so to be in a complicated system and it's not intuitive, they're wasting a lot of their time. So that's that's the first benefit. The second benefit is that the system is affordable. So if you are an Ask member, AASCOnline will only cost you $595 a year, and that includes training and technical assistance. They also have a how-to training videos, so service coordinators can access those anytime. The third benefit, as I said before, good customer service. They're really responsive. Our service coordinators at Volunteers of America probably call them like 20 times a day. I mean, it's just constant. So they're very patient and they talk to you like they're trying to help you and not making you feel like you're, you know, that you're not so bright. Four, you can generate property and national level reports. So you can run reports showing residents' health status, demographics, even hospitalizations, anything that we put in the system, we can run a report. Fifth benefit, it provides the service coordinators with a property level dashboard that flags when there are follow-ups that they need to deal with. And the last one is that it has improved staff's accountability. So I have like two examples or types of reports that we use. So let's look at the hospitalization report. So unplanned hospitalizations were the second largest health-related incident at our properties. 160 residents had unplanned hospitalization with an average length of stay of 6 days. 30% of our residents were admitted for complications related to cardiovascular disease, falls, and infectious disease. If I hadn't run the report, I don't think I would have known that for our overall portfolio. We ran this report and I'm like, oh my goodness, this is really interesting data. So with this, once we got the information as a result, we provided training to our service coordinators to help residents address those specific health needs and to help them deal with their issues before they have to go to the hospital. Another one of our reports that we found helpful was called the Complete File Report. So Volunteers of America has a list of required assessment tools and forms that the service coordinators must complete. So this Complete File Report allows the service coordinator and the quality assurance director the ability to quickly identify incomplete resident files. So here's an example of a complete resident file report. So this report, the service coordinator can review a pre-built report that identifies missing information by using the caution sign. For quick review, for example, the service coordinator has a resident file dashboard. And on this dashboard, for example, you can see that on this one, that only six residents have a complete file. This is actually a new service coordinator. So in terms of these reports help service coordinators at least put the basic data in the system. We think that our reports are as good as the data going in. So this gives us an opportunity to ensure that all information that we need is in the system and that we can go back at this point and just check whether or not it's correct. So AASCOnline limitations, I would say, even though they have these dashboards, I think we have a limited number of dashboards. We need more. There's so much data that's being handled by the service coordinator. I think AASCOnline needs to improve the number and the type that we have to keep so the service coordinators can keep up with the information. We also need dashboards to compare our properties outcomes. I'd like to be able to have one day, we have a lot of properties in Texas, and so a service coordinator at one property can run a dashboard or look at the dashboard and see that, oh, wow, this property over here in Dallas has a low social isolation number. So maybe I need to call her or him to find out what are they doing? So it may help us with best practices if we knew what was happening internally between each property. The second limitation is the reports are pretty basic. So that was pretty impressive, Christopher, what you have. Our reports are basic. If I got a pretty report like that, I did it myself. So you can't just put in variables and think you're going to get a great report. They can do it for you, but I like to run my reports independently. So we need prettier reports with more graphics. We'd like to turn our raw data in a beautiful report with the click of a button. We also need more robust reports. For example, I'd like to track residents' wellness status based on the services they receive. And we can do it, but it's not, when you run it, it's complicated to see what you're really trying to see. It's not as simple. And I would say the third limitation is that it has a limited data figuring component. You can't just isolate certain variables to see how things are working. You just have to ask them to do it for you, and you'll get the information, but you can't do it from your own computer. And we've been talking to the AASCOnline staff, and they said that they're hoping to address some of these areas of limitations in 2021. So that's
just in regards to Donna talking about the complete file, just how we talk about it being intuitive. So if you're a service coordinator and you're looking at this and you're seeing, okay, I have these checks, that means these files are complete, and I have the triangle showing me something is missing. It's telling you, okay, here, there's a triangle because it means it's been a year since an assessment is done. Or if there's a triangle here, it means the phone number and the information here is missing. So it's just telling you where the information is missing and where you need to update it so that your file is complete. So that you just have a big, shot at once. Okay, I'm trying to update my files. Kind of what do I have to work on? And this is kind of easy for them to see and make corrections to it. And as a quality assurance person, you can also use this and have a conversation. You see, you need to work on this, or there's certain things that a pattern that they need to work on that you can follow up. And then with this, you have things that are pending. Like if you have a pending follow-up task, or you have a pending service need or violations, or somebody they're struggling with an ADL, it comes up here and it reminds you, you can click on it and see, what was that need that needs to be addressed. And until you resolve it, that little bubble will stay there, kind of reminding you of these things or the tasks that needs to be followed up on. So it's a good reminder tool to let you know what you're missing, helping you complete your files and helping you stay up on the requests and the needs of your residents. So if you say, I'm going to follow up with you in 30 days, you put that 30-day date in there, and that stays up until you complete it, which is good as a way to do your kind of to-do list and follow up with what's going on with your residents.
Yeah, I think AASCOnline is for the user, and that's why the service coordinator like it so much. Some systems are for the people who are running reports, but so they're dealing with the user's needs first, and that's why the reports probably aren't so great. They just want to make sure, and you know, it was targeted for the HUD funded service coordinator, so very specific to that population. And we like it, and I think at some point we'll be able to get all the reports, but it's going to take time. I'm not expecting this to be overnight. They're at 16 years now, and this is what we have, and I think, you know, we might need another few more years to get everything we may want.
Donna and Natasha, we had a question that came in about how you all capture the data. You track quite a few indicators. You know, I know you do. Can you talk a little bit about sort of the survey and individual assessments, how you're actually, what kind of tools, very high level, that you use to collect the data?
Oh, too many assessment tools. I mean, it's just too many. I mean, I can name some of them, Natasha, you can name of it, but we do the VES, Vulnerable Elder Survey, to determine the activities of daily living. It's basically an activities of daily living survey, but this is something that Rand and Dr. Saliba actually developed, so that if you scored a certain score, this is telling the doctor or whoever is doing it that maybe within a few years, if you continue down this road, you might not live. So it's a very strong indicator for us. And so, you know, our goal is to have residents be as healthy as possible. So we do all of these health-related assessment tools. So I'll just name them. We have the Lubin scale, which is social isolation that Mercy is using. We have the PQ9, which is a depression scale. We have now we've integrated, and ASC has done this for everyone now. We've integrated the IWISH program assessment tools, and they came with like 5 other assessment tools, like for nutrition, fall prevention. They just have tons of, so we have lots of assessment tools at this point. And right now, Natasha's working on a well-being assessment. And go ahead, Natasha, tell them about what we're doing with that assessment.
So we're looking to partner with the National Council on Aging. They have an adult well-being assessment that they use, and they've actually piloted with other organizations and have some good data on it. And so we're looking to see if we can implement that as well, to see, you know, the well-being of our residents. In their words, are they thriving, are they surviving? And then again, benchmarking that, see which properties get a high rate and compare to other properties that are struggling, and say, hey, what's going on? Where can we do a deeper dive to see why these residents are rating their well-being as low, where these other facilities are rating as high? So just another, that's where we're going strategically. We're looking at the health and well-being of our residents. We're working on right now, hoping to roll that out in 2020.
So we're just doing these things so we can, and this is not easy, and we're not like, we're not at a fantastic place with it. We ran the complete file report for the first time, and I'm like, oh my God, nobody's doing anything.
A work in progress.
It's all in a work in progress.
So I will say the good thing is that when we roll out a new assessment, that we create something brand new and AASCOnline, they provide the training for us. They explain it, they do screenshots. So it's never just get it done. We have training that they record and put in our library for specific training that we do outside of their basic templates. So it's never just throw it out there. They work with us to design the training to make sure we get the message across of what we're looking for. We join in on the trainings if there's questions from a VOA specific standpoint as well. So the training is a big piece that they are really good at and very hands-on with, which is very helpful.
Terrific. Thank you. I want to turn it over to Natalia, who is going to talk about Family Metrics, which is also designed by Pangea Foundation. So there will be some similarities, but it's the companion platform for family properties. So welcome, Natalia. Are you able to share your screen?
Yes. Hi, everyone. And I'm so glad that Natasha and Donna went first, because everything you saw that they have, Family Metrics has too. So they're basically the same system, except that AASC is more geared towards senior properties. But Family Metrics have the same capabilities and most of the same tools. So I'm going to give you a little background about Operation Pathways. Operation Pathways serves 28 out of the 28 properties from the NHP Foundation in 16 states, and that's about 9,000 residents, both senior and multifamily, but mostly multifamily. OP always had Family Metrics, but they weren't really using it until my role came in 2017. I'm a part-time data and outcomes manager, but I supervise data entry and data collection. So that's my job. So it wasn't until my role was created that accountability, training, and more like of a data-driven culture was established. And I would also say that it took a good 2 years to get us to a good place. Where do we collect data? Directly from residents. Operation Pathways doesn't manage, or NHP and Operation Pathways, we don't manage our own properties, so we don't have access to the data software of the property managers that we hire to manage our properties, which is a struggle because they can collect data for us and we don't have access to their data. Luckily, Family Metrics is working on integrating with lots of this property management softwares. So in the future, we can just gather data directly from the system. So the systems are communicating rather than a human being having to be responsible for all the data entry. I want to show you just a little bit of what I'm going to go to my training property. And just to show you, and I'm glad that they showed you the reports because I wasn't planning on, but very useful. And obviously, we have the same reports. So if I'm going to a residence profile, I can enter, let's say that right now we're helping everyone register to vote. So I'm just going to select their profile, go to the community and civic category and go to the register to vote. So if you do this for individuals or groups or events, then we can run reports on who we helped register to vote by property and also as a whole. Another thing that we can do is create programs on our properties, and we can do this by property based on partnerships that we have. So for example, this property has a partnership with DCHFA, the tablets, but we also have the America Saves Week, which we do across the board. And you can track attendance and outcomes based on programs as well. The other thing I want to show you is that you can customize Family Metrics, and it's pretty affordable. So just like Natasha and Donna said, Family Metrics is great at gathering data, but not so great at tracking outcomes. So what we did is we customized the system to track our own outcomes that we wanted to track as an organization. And we have healthy habits surveys, assessments, questionnaires, however you want to call them. We have our resident survey, and the reporting for this survey is pretty great and useful. The challenges with the system are the reports. It's basically a lot of raw data, and we don't have the capacity to dive in and create those wonderful reports that you need to share the data. And so that would be one of the challenges. And another challenge is that you can't really upload data. Like let's say you get a bunch of data from somebody, from the property manager about demographics of your community. It would be great if I could just upload that data into Family Metrics, but that's not something I can do. Someone manually has to enter all that. And you know, our resident service coordinators are busy as they are. So that's definitely a challenge. I want to show you one of the things we do with the data, and it's if I can figure out how to share another report. For example, I'm going to show you, this is a quarter report that we do for each property and also for our entire portfolio. And we use family metrics reports to do this. And we have residents that receive direct service. We can pull residents that have health insurance, residents that went from not having health insurance to having health insurance, residents that we helped find employment, et cetera, et cetera. And another thing I want to show you is that I'm going to go back to family metrics, is the Standard for Success report. If that's something you have to do and something you're worried about, I want to show you how easy it is to run this report in our system. So you go to the Standard for Success dashboard and you click Submit the report and you're done. So if that's something you have to do, I mean, this is a really good selling point. Then we have the Resident Connect tool, which is the robocalling. And the great thing about it is that the phone numbers and contacts are already in family metrics. So all we have to do is select who we want to send a voice recording or robocall or text message to communicate with our residents, in which right now, because we can't do a lot of in-person program and services, it's been great for us to communicate in different languages, and it's been working great. And this is a tool that they just added. It's also very affordable. The other thing I want to mention is that you can also track professional development in the system, partnerships, volunteer hours, donations, in-kind donations. And the last thing is we too felt like we were outgrowing family metrics. So we were thinking about Bertha. And so what we are going to do is probably integrate both systems in the future. And so Family Metrics is open to do that, open to work with us to integrate both softwares. So that's hopefully on the works. And that's it for me.
Thanks, Natalia. We got a question that came in through the chat. Can you get the raw data file from the system? And if so, then, well, let me stop there. Can you get a raw data system, Excel form from the system that you can pull the data and then manipulate it and analyze it outside of the system?
Yes, and we do. That's what we do.
And I want to confirm that that is also true for AASCOnline. Correct?
Yeah, what happens is we typically ask them and they can create an Excel spreadsheet of anything that.
I want to also add that it is very affordable, but more than the affordability, working with Pangea and their customer service is so outstanding that, I mean, they're always answering your questions, always providing trainings the same day, and so they're really great to work with. But I'm the person that runs all the reports, and I also want to say that one of the things we do a ton of is we supervise based on our system. This is how we know if our RSCs are working or not. So every Monday, I run reports from the previous week to see if the RSCs enter the data and what the data looks like. And so we're in 16 states. They don't see us maybe once a year. And so I would say that supervision, how we choose what programs and what partnerships are going to go where is all data driven. Yeah.
And AASCOnline has the Resident Connect as well that just rolled out. And I know we were able to pay for that with CORES funding. That was an eligible expense.
Well, I see your name was on the little, maybe they've given us kudos for helping. Did you see it, Natasha?
Oh. But Resident Connect has been amazing, I will say.
Yeah, I mean, you have to pick what works for you, and right now, they're the best for us right now. And do you want me to say
So we had another.
Bertha yet?
I'm sorry.
I know Natalia was talking about Amberta. So
Oh, sure. You could say it would be great to say a couple of words. We're not featuring that one, but this is a new system. There's a free version that's available, but there's also this sort of enterprise level. Donna, why don't you share a few
well, you
few
know,
words about
right
it?
now, I think Ask is Ask is on the call, so they could probably, you know, Michelle can come in and say, talk about Aunt Bertha, but I'm really looking forward to the relationship that the organization Ask is going to have with Aunt Bertha. I mean, they are going to have a partnership that's going to be called My Community Directory. And Ask is trying to, the plan is that Ask members will be able to log into My Community Directory through the Ask website. And that will be a way for them to find resources in the community. And one of the reasons it's important to us is that the HUD funded service coordinators are required to develop a community resource directory for their residents. So to me, to have Ask the organization and Aunt Bertha coming together to give us this robust community directory is going to be so helpful. It's a win-win situation for the Ask member, because they will help Aunt Bertha build their database by providing them with new resources, and the service coordinator will have access to all community resources that are available in that community. And I think that one thing about Aunt Bertha, the Ask members will be able to make referrals directly through that system and receive updates on the status of their referrals. I'm really looking forward to it. And I think with having the organization Ask, they're going to put this is going to be probably a membership benefit. It'll be in the cost of the membership fee. This is going to be amazing if we can do it. And they're working on it. I don't know exactly when they're going to have it, but it will happen soon. They're in conversation. So, you know, Natalia, I don't know what you're going to be doing with the AASCOnline or Family Metrics. I will say that it is the hope of the Ask that they're going to integrate this in the AASCOnline system at some point. That's their plan.
Great. We had another, we're just nearly at the end of time, but we had one last question about what's missing from Family Metrics in terms of the integration with another software. I think this relates to the property management integration. And I wanna, if we can get a quick answer from Natalia on that, and I wanted to circle back also to Chris, just to confirm how ETO integrates with your property management software as well. So let's start quickly with Natalia and then go to Chris.
What's missing is our own fault. It's not Family Metrics. We work with so many property management companies that getting the right person to give us what we need to connect with Family Metrics is being a challenge. So it's not, we're dropping the ball there. So they're ready to do it.
In our
Thanks,
case,
Chris?
yeah, in our case, our data journey is a little bit further along. We have an enterprise data warehouse that integrates with our property management software. It used to be RealPage. I'm sorry, it used to be Yardi. It's now RealPage. So we currently have an FTP connection that batch uploads data from our data warehouse on a nightly basis. But I can tell you that ETO also offers API capabilities as well to integrate into data warehouses or third-party systems.
Lots of data jealousy happening now.
And I will say, as we talk with other practitioners, that's one of the major areas of concern when they're looking at systems is how are they already sort of leveraging the compliance and property management data that they have whether they self-manage or they're working with third-party property managers. So that is one place as you're looking at systems that is frequently an area, a source of friction and challenges, that to look at that and think about that as you're making any decision about a system. All right. Well, we're just now at 4 o'clock, so I want to be sensitive to everybody's schedules and thank everybody for joining us today. Thank you to all of our panelists and presenters for sharing your wealth of experience and perspectives on all of this. In the chat, I've shared links to the CORES resource library and the COVID resource page. There are some of these resources that were mentioned today. The analysis that Nicole did about the different data systems, that is also available in the CORES resource library. So we encourage you all to take a peek there. And this recording will also be posted there in a couple of days. So again, thank you and have a great afternoon.
Bye.